We are back with Dr. Olu Jegede, Senior Vice President and Chief Health Equity and Community Impact Officer. He's with Cone Health. We're talking about how blood sugar impacts your life. And we just talked about how there's going to be an event on Saturday that anyone can come to for free to check their blood sugar. But let's talk about this, lifestyle changes that any of us can do to make a big impact on our blood sugar levels.
Thanks, Tanya. Absolutely. Lifestyle changes are crucial in maintaining healthy blood sugar levels and preventing those diabetes-related complications that we discussed earlier. So there are some practical everyday steps that you can do. One of them is eating healthy diet. It sounds simple, but you can actually pay attention to this, following a balanced diet and sugar-friendly eating plan. So you can discuss this with your doctor, or you can discuss it with your nutritionist and come up with a full plan that is sugar friendly and is not really having all those, high calorie, high sugar carbohydrate diet. Those are not good for diabetes. Also engage in regular physical exercise. You can do this at home, maybe 30 minutes per day. The American Heart Association recommend 150 minutes per week. So you can do it as you want. You can take a walk in your neighborhood. Brisk walking is good. You can actually listen to music and walk up and down in your house. If you have a staircase, it helps to do that. And you can do it with family to make it fun. Other thing is just staying well hydrated, making sure you drink plenty of water, not soda, but water, getting adequate rest to reduce stress, because stress can increase your blood sugar by increasing the stress hormone and making blood sugar really high. Then take your medications, discuss with your doctors, tell them what you are going through. If it is, like social drivers, finding help will reduce the stress. So just make sure you are open with your provider when you go to visit, and ensure that you have a shared decision making when you leave.
Okay, let's talk about how to check an A1C level. First off, what is an A1C level, and then how should adults check that?
So A1C level is the measure of your blood sugar control over 3 months, and it is recommended if you have diabetes that we check it every 3 months, depending on your level. So some people will check every 6 months. If it is pre-diabetes, you can check every year, just making sure it's not going up. Once you are already diagnosed, if you are controlled, say your hemoglobin A1C is 7. By the way, the normal is below 5.7. So if you are 7%, we can check every 6 months, depending on how you are managing your blood sugar at home. If you are not controlled, say above 8, then we check every 3 months to tighten the sugar control so it doesn't go even higher, because after 8%, it starts to show in the kidney and can easily destroy the kidney. For older adults, like in their 60s, 65 and above, we're usually very careful in the control so we don't, lower their blood sugar too much. And so for that reason, we may, allow up to 7.5 in their hemoglobin A1C. And for that reason, too, we check accordingly, maybe 3 to 6 months for older adults as well.
All right, and as we are wrapping things up, we want to remind you about Saturday's event. That Saturday event is free. It is there at Ebenezer Church, and it is so that you can help control your blood sugar and for long-term wellness as well. Thank you so much for joining us. We appreciate that. It's going to be in the To Your Well-Being section of our website.
Thank you.